An Affinitates virtual forum sponsored by Children's Organ Transplant Association recently took place. Community and healthcare leaders came together to learn and share as they discuss ways to bridge the gaps between patients and healthcare. Here are a few video highlights.
My perspective on that is what the gap is and remains in a lot of cases is, I'll put it in sort of one word, and that's engagement. And is, I think that there needs to be a greater focus on truly engaging with the patients.
Is the whole concept of silos within healthcare, within hospital systems, where one organ group may not talk to the other organ group, may not talk to the other organ group, and we're retelling the story over and over again. There's not a lot of communication.
I agree. I think we need more champions of data sharing and information sharing. Right, there are lots of different approaches on how you can engage across the whole spectrum.
The biggest problems that we have is the way that payment is structured right now, and that pulls in technology. If people aren't seeing that, they're going to get some big ROI from using technology, for providing different services, and we're not doing that.
There are a whole complexity of issues, I think, that are working against medicine in general right now. But my experience anyway has been that communication is the key for all of this, if you can get them to think about communication.
And so our patients aren't going to the transplant centers or going to regular checkups in person. It's all being done by telemedicine. So getting that communications piece, hands-on, getting a chance to talk to someone, we are a couple of steps away from where all that action is taking place.
They haven't had a big advocate out there. And I think that group of people that wouldn't otherwise get into the system need organizations to fight for them. They need organizations like Rick's organization.
I think eventually we're going to get there, because I don't think that we can let the healthcare continue to consume the percentage of GDP that it does. We can't. We're starving other sectors of our economy because we're absorbing so much of it in healthcare.
Do you think healthcare is consuming too much of our economy? What ideas do you have for narrowing gaps in the healthcare system? Add a comment below or send a message to share your thoughts.